Welcome and thank you for joining the ASPPH Presents webinar, Discovering Your Authentic Health Career. I'm Tracy Seward, Senior Director for Outreach and Recruitment at the Association of Schools and Programs of Public Health, and I'm very happy to moderate this session. It's my honor to introduce you to our speaker today. Jeff Oxendine is the founder and CEO of Health Career Connection, a national nonprofit that inspires and empowers the next generation of diverse health leaders and professionals. He's been a health executive, educator, and consultant for over 30 years. Jeff started out as a hospital administrator and a medical group executive and changed paths to become a faculty member in health policy and management, associate dean of public health practice, and co-director of the undergraduate major at UC Berkeley School of Public Health. He is a healthcare workforce and diversity consultant and recently served as co-director of the California Future Health Workforce Commission and currently serves as co-director of the California Health Professions Consortium. He is also the author of the newly released book, You Don't Have to Be a Doctor, Discover, Achieve, and Enjoy Your Authentic Health Career. I encourage you to ask questions at any point throughout the session by clicking on the Q&A button at the bottom of your screen. Today's webinar is being recorded and will be available soon on the webinar event page on the ASPPH website. And now I will turn it over to your speaker, Jeff Oxendine. Thank you.
Tracy, thank you much. Thank you very much. And I really appreciate the opportunity to present today. It's good to be with all of you. And we're going to get rolling and talk about you and your authentic health career and how you can discover and achieve it and make the kind of impact that you really want to have. The next slide is going to be talking about what we're going to be doing in our hour together today. I'm going to start by talking about hot and emerging health careers so that you're aware of what the possibilities are right now and how COVID is impacting that. Then the rest of the time, we're going to focus all on you and how you can choose your authentic health career and be successful. And then the kind of things you can do right now. And to get started, we want to get a chance to see who's all in the room. And so if you can answer these two polling questions, where are you in your educational journey? We just wanted to see what level that you are in and kind of where you are. And then really importantly, which health issues are you most passionate about? And we don't have all of them that are possible there, but just identifying some that you're most passionate about, because it's important to tap into your passion to be able to pursue your authentic health career. So just take a moment, answer these questions, and then we'll see who we all have here. It's great to see such a range of people at different stages in your journey, and also to see the issues that you're really passionate about. We need people who want to address these issues and more in the healthcare and public health field. So I think we're almost there. Let's see. So here are the results. So it looks like we've got a pretty good mix of people who are graduate students, people in the health professions, folks that are later in their college career, and people who are just getting started. And welcome to all of you, and welcome to the advisors as well. And then it's heartening to see the passion for all these health issues that are needed by our populations, but particularly access to care and health equity, and addressing the social determinants of health, which are absolutely critical right now. So thank you. It's good to see that. Now keep connected to your passions as we go through this, because working towards your passion is a big part of pursuing your authentic health career. Next slide, please. So as promised, we are going to start by talking about hot and emerging health career paths. And by hot and emerging health career paths, I'm referring to those in which there are already shortages and which there is projected to be increased demand over the next 10 to 15 years for more professionals in each of these areas. And these are areas to start with that are clinical career paths. And there's a huge demand for increasing the number of people, particularly in primary care, whether that's a physician or a nurse practitioner or a PA or even medical assistants. And some of you can get great experience being a medical assistant on your way to being a medical or public health professional of some kind and getting good experience and getting paid. Behavioral health is, which includes mental health and substance use, is one of the biggest, most critical needs that we have now and going forward. And the pandemic has only exacerbated that need. And you can see the other areas in the clinical workforce that are also needed. The next slide are the non-clinical careers that are hot and emerging. Of course, we have public health, which is now in the spotlight on the front lines with COVID, but has always been a priority need and will be once we get beyond COVID. And within public health, a big need for people on the health policy and management side, which like me, who came through the health administration path, that the leaders of health organizations, many of them are nearing or at retirement age. And we're going to need more people who want to step up and lead organizations, and where you have the influence over how the organization will respond to those health issues that you're passionate about, and how you'll utilize your resources to do that, and how you affect change. Huge need for people that want to work on the community health worker and health navigator side, which is also something that folks can do as students or as you're getting experience before going to graduate school or as a career path going forward. There's going to be more work in that area focused on prevention, focused on mental health, focused on building healthy communities and COVID reduction. A big need in data and analytics in particular. I led a panel this last week of senior health leaders in hospitals and health plans and many other private sector organizations. And one of the biggest needs they were saying is people to do big data and analytical kind of work going forward. And obviously a huge need in digital health and health technology, particularly with telehealth now, and with people, the place of care has shifted to the home or in particular. And so needing to use digital health and health technology to be able to care for people there. And we also need folks to be entrepreneurial at this time. And there's a lot of opportunity in startups right now, particularly digital health and biotech and other kinds of startups, and folks that want to disrupt the way we're doing things. And COVID is creating a crisis where we need folks to step up and be entrepreneurs. Next slide, please. And so Tracy mentioned that I was the co-director of the California Future Health Workforce Commission. I know we have people here from all over the country, maybe all over the world. In California, we actually, health workforce and diversity were such priority issues that we actually had a full commission for 3 years that worked on what are the priority needs and what are the solutions for advancing those needs. And in California, the consensus needs were that the hottest areas, the most important areas to the health of California were primary care and prevention. And prevention includes public health, includes community health and building healthy communities, includes behavioral health, as we already talked about, substance use and mental health. And really importantly, includes healthy aging and care for older adults, people aging in place in their homes and then being supported all throughout their lives, including the end of life. So these were the 3 areas, and obviously there's intersection amongst them, that were most important career options for health in California. And I think this will be the case in many other parts of the country. And of course, a huge emphasis on having a workforce, a health workforce and leaders that reflect the diversity of the community and have the language skills. And COVID-19 has shown the impact of the disproportionate impact of COVID on communities of color and under-resourced communities. And so very important that we have a workforce that can address those issues now and going forward, that we have more equity in terms of health outcomes, but also opportunity and education, and that we leverage technology more. And so this is the focus in California, and I believe going forward. Next slide. So public health was mentioned as one of those priority areas. I think many of you are public health undergrad majors or in graduate school or graduates who are thinking of coming to public health. So I probably don't need to make the case too much to you, but I think it's important to say that public health is about social justice. It's about addressing underlying inequities. It's about addressing systemic racism and other structural barriers that our communities have been dealing with for too long. And it's about really empowering people and communities to be able to have the conditions that we need for them to be healthy. And it's about going upstream and prevention. And we have growing disparities. We have growing population health needs. So we need more of you to go into public health and to make a difference, whether that's as a public health leader and professional or just by being a more effective clinician. The most effective clinicians, doctors and nurses and others going forward are going to be people who do their work through a public health lens and also are working on public health. And don't let anybody tell you have to be poor to be in public health. You can do well by doing good in this area. Next slide, please. So within public health, there are many career options, and these tend to correspond also with the graduate school option, the graduate education options. We already talked about health administration as a growing career option. Health policy is an area that we need more people to go into as well. And think of the impact that you can have working on health policy, impacting millions of people with the policies and with the budgets and the things that you come up with. And we need folks in all of these different areas of public health. So your job, if you don't know it already, is to figure out which of these areas of public health best align with your unique talents, your passions, your goals, and which of the paths are most exciting for you. I have some other presentations, and if you put your name in there's a place to put your name on a form to get some more information from me. I have other presentations I do around going deep into each one of these areas and what are the jobs and the career paths and the skills that are looked for in public health. So would be happy to share that with you going forward. But get some exposure and experience in public health and pursue this, whether it's public health alone or in combination with a clinical career. The next slide, please. And it's important as you look at public health to realize that in public health, there's a wide range of sectors that you can work in. Right now, we've got heroes working in public health in many of these sectors, particularly in the governmental public health side of things, in city, county, state health departments and the federal level health departments, the CDC and others. And we got to be grateful for people doing that work. And hopefully some of you will pursue governmental public health. But in addition, public health is practiced in all these other kinds of settings, including an increasing amount in hospitals and health systems, increasing amount in community health centers. These are places where there's going to be more of an emphasis on being at the intersection of building healthy communities and public health with the delivery of health services and particularly addressing the social determinants of health. And also in the private sector, I'm now working with more and more companies from the private sectors who are being able to hire more people in public health as well. The next slide, please. And then not only do we need people in all these areas, we need to increase the diversity, as mentioned already, of clinicians, public health leaders, behavioral health leaders to match more of the population. This just shows some slides in California of the Latino population and African-American populations compared to the number of physicians and PAs and NPs. And you can see the huge gaps that are there. And it's the same in public health and in mental health and in other areas. And the same goes for Native Americans and goes for many of the Asian populations that we have, and also under-resourced rural populations and urban populations. So a long ways to go. That's where you all come in. Next slide, please. So what's the impact of COVID is that there's been significant challenges that we've had to respond to, and we still have a long ways to go. More opportunity for people to do frontline public health work as contact tracers, as case investigators, people that are involved in surveillance. Telehealth is now the way that health is going to be provided, including health education and mental health and all kinds of other things. So that's an area to really look into and see what roles you might be able to play. We have a huge challenge getting personal protective equipment and other supplies out to our frontline heroic workers. And the implementation of the vaccine next year is going to be an amazing supply chain effort that is an opportunity for many of you to do some work in that area to really have an impact and get great experience. And then we already mentioned the importance of the data analysis, which is so much more of now with what's going on with COVID and the impact on people on behavioral health. And we need more people in the public health workforce now and going forward. And I think there'll be a recognition of more investment in the public health infrastructure. So the crisis is horrible. My heart goes out to any of you who have been impacted by COVID or the economic fallout that we've had. And it's also a moment where we need to get more investment and more people going into public health to be part of the recovery and to be part of that future public health workforce to prevent these issues and do a better job going forward. Next slide, please. So some of you, I bet many of you, I wish I could see you all and have a raise of hands of how many of you are interested in combining public health and medicine. And these are ways that you can do that. You can be, this is my friend, Dr. Muntu Davis, who's the Chief Health Officer for Los Angeles County. And he's got an MPH and an MD. He's the one involved in deciding about opening of schools and restaurants and, you know, COVID protocols for businesses and all those kinds of things in that area. You can be a prevention medicine specialist. Many of you are probably interested in coming into health because of wanting to prevent. You can be a medical director or a researcher or just a more effective clinician, as we said earlier. So hopefully many of you will combine public health with medicine or NP or PA or behavioral health or whatever you're passionate about. Next slide, please. And then no matter what health career path you go into, all of us are going to have to really focus on the social determinants of health now and going forward. I have some students who are saying, Jeff, I went to work for a public health organization and they're having me work on economic development. Is that public health? And I said, of course it's public health, because right now people need income. The things that are most correlated to your health are having income, having hope, having opportunities. And with a job comes opportunity and hope and health insurance and those kinds of things. Food security is a huge issue right now, given the pandemic. And we also need to focus on building more power, more hope and agency amongst folks. So these are things that you can work on as part of being a public health professional or in addition to your role as a clinical professional. The next slide. So that's a quick overview of some of the most hot and emerging health careers and how COVID has impacted them. We want to get a sense now about what your interests are. And I'd like to have you answer which health professions are you most interested in pursuing at this particular time. And then also let's see. And the second question is, if you're interested in, I guess that's going to come later. If you're interested in public health, which areas are you interested in? Nice to see so many people focused on public health, and also many that want to combine, physician and physician assistant in public health. And good to see the interest in policy, digital health as well. Looks like a pretty equal distribution across different areas within public health, but with nice to see as many people interested in global health, which there's a huge and growing need in that area as well. So great, this gives me a good sense of where you're coming from, and you can see who's here with you. And so I'll keep this in mind as we go through the rest of the comments. I'm going to take a couple questions now. Just pause and take a couple questions from the Q&A around which are about your issues around health careers. So let me take a look here. So I'm going to address the issues around, there's a question about narrowing passions in public health. I'll be going through that a little bit further as we go along. I'll also be talking about how students can go between undergraduate and graduate to get their foot in the door and start their career. That'll be coming up, so stay tuned. And then behavioral health is a question, how does behavioral health relate to COVID? I think it relates to COVID in that the situation that we're all facing, the impact of COVID, as well as the shelter in place, the economic challenges, the more systemic racism issues that are becoming even more magnified in this time, are causing more stress on people and families having to be at home doing work, having children at home, children and adolescents having to go to school, and college students having to go to school online, all of those things combined has created more stress, more maybe exacerbated mental health issues that people have had, and unfortunately increased substance use issues as well. And then the question about the global health as a field of study. I think that global health is, if you want to have an impact on global health in developing countries or in other countries that are in strong economic situations, there was a need prior to COVID, and it will continue to be a need, on a wide range of things, from environmental health, including healthy water and air, to access to addressing infectious diseases like COVID, to building programs and doing health education. All the same issues that we have in the United States, need for public health in some cases are greater in other countries, although many communities in our own country are facing significant public health, same kind of issues you address. And so I think going into those areas, and there's great schools of public health that focus on global health and can help you get your foot in the door. I think the ability to do that in the next couple of years, really, given the pandemic, it may be a little bit harder to do work in country, but you can still do global health, from more of a distance here. What area of public health where I consider communication? I think communication cuts across all different aspects of public health, and it's going to be an increasingly important part. Particularly health behavior has a lot of health communication under it, as does health administration, as does being able to use data effectively at this point and communicate. You can see the New York Times and many other places have significant communication around COVID right now, and the way they're visually describing things and the way that they're messaging to the population about how we need to address COVID. I mean, that's really, front and center what we're dealing with right now. So I think health communication cuts across all areas, but a graduate education would probably be more in health behavior. I think, again, we'll talk about multiple passions in public health. How do you navigate multiple passions in public health? I think one thing you can do is you can pursue different dual degrees. I have an MBA and a Master in Public Health because I was focused on health administration, and I wanted to be able to do work in management, but also do online, on the ground public health work on issues I was passionate about, like access to care for underserved population and health equity. So I think looking at dual degree programs, not only MBA and PH, but perhaps Master's in Public Policy, MPH, Master's in Social Work, MPH, obviously MD or PA, and MPH. Even city and regional planning. We've got to build healthy communities going forward, and that's about combining public health with city and regional planning. And then a public health minor is definitely a way to get into the field. It wouldn't be as in-depth as having a major in public health, but it certainly would give you exposure to the core concepts, to some of the key skills, and could set you up to help get a job in public health afterwards, after undergraduates, with maybe the intention of getting a master's in public health degree, but also good to combine with a clinical career. So a minor would be fine if you don't have the capacity to do a major, but if you have something else that you're more interested in a major. I'll do a couple more questions, and then we'll have some time for questions at the end. For health management, do you recommend a public health undergrad degree or a business degree? I think it's less about what you need for an undergraduate degree. I think a public health degree gives you a leg up on health management, because you learn about the industry, you learn about the terms, you learn about the key players and how they all fit together. You might get connected to people in the industry to get internships and for job placement and those kinds of things, but you could certainly pursue it as a business degree as well. And then I think the most important is getting some paid public health work experience post-undergraduate in health management, whether that be consulting or health plans or hospitals or public health, and then choosing the graduate program that you want to go to, whether that's public health or MHA or business. So I'm going to now turn back to the main presentation, and hopefully I'll have time to answer more of these questions towards the end. The next slide is focusing on you and how you begin to choose your authentic health career amongst all these options, right? It's a great opportunity, but it can be daunting right now to try to choose, especially if you're at the undergraduate level or you graduated, you're trying to figure out which pathway to go. It can be a challenge. And so I wrote a book called You Don't Have to Be a Doctor. In no way does it discourage anybody from being a doctor. If you want to be a doctor, we really need you and really want you to do that. But it helps you to critically assess whether you want to do that. And very importantly, it's a practical guide with 9 steps that I'm going to share with you in a couple minutes about how you can go about deciding on your authentic health career, which one or which combination of options will best suit you, and how do you get a job? How do you network? How do you increase your belief and courage that you can get to where you want to be? And how do you prepare for graduate school and beyond? And those of you in graduate school, how do you get that postgraduate school job and navigate your career as you and the world change? So it's a $21 book, a small price to pay for being able to help you figure out your authentic health career path. And I've helped thousands of people with what's in that book, and hopefully it would be helpful to you. It's available on Amazon. The next slide, please. So I wrote the book, and I've been doing my work on empowering people to, which is my purpose. My authentic health career is now empowering people to make good choices, well-informed choices about your health career option. My part of public health prevention is preventing you from making a career choice that doesn't work for you the first time around. So I'm going upstream, talking to you at this stage where you're trying to make some important choices about grad school and jobs and careers, and want to help you make a well-informed choice. The next slide, please. So I know that you can discover and achieve what I call your authentic health career. There's only one of you in the entire universe, and you're here for a reason. And you're blessed with various talents, passions, goals, and a unique lived experience that you bring to being a health professional. And so I know that you can find the authentic path, which is the one that's really you, right? And it's the kind of impact that you really uniquely can have. So my goal is for you to find your authentic path so that you can be happy, you can be healthy, you can have the impact you want to have. And then all of us will benefit from you being able to do that. And so it's a privilege to choose this path, but you all are in a position to do this. So let's talk about how to do it. The next slide, please. This comes from Steve Jobs, a little bit eerie. He said, your time is limited. He only lived to be 57 years old. Don't waste it living somebody else's life, and really know that your heart and intuition, really know what it is. You may need more exposure. You may need more experience. You may need, you may not just be ready to choose yet, but you'll know it when it's time. And so have the courage to make that choice of your authentic health career. Next slide, please. It's not just a concept. It sounds good. Oh, choose your authentic health career, right? But it's also important for many other reasons to choose wisely. And, it's about your 20s. Your 20s is a defining decade. There's a book called The Defining Decade about the choices you make in your 20s and the progress you make, how that impacts your life. And so for those of you who are thinking about being a doctor, and some folks don't like this, but I'll say that becoming a doctor, if it's your authentic path, is really giving up your 20s, because you have to get so much just to get into medical school, to survive and do well in medical school, to have a residency, to have a fellowship, to get your job. It takes a lot. And if it's your authentic health career, please do it. And there's nothing more rewarding than doing that. But if not, you don't want to give up your 20s, and you don't want to incur a lot of graduate school debt in order to do that. And graduate schools are looking for fit. They're looking for people who, whether it's a medical school or a public health school or a business school, they're looking for people who can authentically say, this is why I'm applying to your school, and this is what I'm going to do with it, and this is why I'm a good fit. My friends that run medical school admissions committees say, I can tell the box checkers a mile away, Jeff. These are people who they have done all the right things on their medical school application, but when they interview them for medical school, they don't hear their authentic passion and their authentic voice for doing it. And the same thing comes from reading Statement of Purpose for schools of public health. I've been on admissions committees for over 20 years. And so the bottom line is, if you can discover your authentic path, then you can communicate that to employers, to health profession schools, to mentors, to family members, to others who will support you. And that'll allow you to have the life that you want to have. And I can tell you from personal experience, the health and your happiness. There was a time many years ago when on paper, I had the best job that I could have had, that was, I was teaching at Harvard. I was a health executive at a prestigious teaching hospital in Boston. I had young children. On paper, life was really good, making a good salary, but I was miserable. I'd been a health executive for 20 years. It was not my authentic health career. And my body started telling me, Jeff, you know what, you're good at this, you can do it, but there's something you need more of. You need to follow your passion, follow your purpose. And so I went to the doctor, and the doctor looked at me and he goes, wow, you look really depressed. I went there for a sore throat. And he became concerned that I was burning out because I was grumbling all the way to work. I was grumbling all the way home. And I wasn't living my authentic health career, and my body was telling me it was time to change. So more about that in a minute. Next slide, please. So how do you find your authentic health career? So I myself have applied this to my reinventing my health career about 4 times. And I've worked with thousands of students to find their authentic health career and succeed by using this model. And first is finding alignment between what the health employer needs, what the health industry needs. That's why we showed you those career options that are going to be high in demand. And that's you also finding out, what is the industry going to be like? What are employers going to pay for? And so if you can find what is needed going forward when you become a health professional, public health professional, or what you can create and disrupt as an entrepreneur. If you can align that with your unique passions, values, and goals, and that's unique to you, and what you're good at and enjoy doing, what you're really good at and enjoy doing, then you can find the alignment. If you can find a career path that aligns these different things, which I know that you can, there's tons of them in the public health and health field, then you can find the alignment between these things. You can have the rewards that are in the middle, meaningful work, financial rewards, satisfaction, and then health and wellness. Back to me in my situation, I knew deep inside that I needed to shift to focus more on the public health issues I was more passionate about, rather than being a hospital executive any longer. And I knew I wanted to work with students, particularly students coming up, undergrad and graduate students in public health, to pursue your authentic health career. So I took a 70% salary cut and moved across the country, back to California when my 3rd child was on the way, and my wife was working in the home, not outside the home. And because I worked at UC Berkeley because that was my passion. I got to work on health equity, diversity. I got to work with students. I got to work more on health career connection to support more students who get into the field. And so I know what it is to make that shift. I took a big financial hit, but it was priceless, my wife and I would say, because I'm living my authentic life and career. I also was able to be a better parent. I was able, not having the health executive schedule, I was able to be a better parent to my children, be more involved in their lives, and have more of an impact on the things that mattered most to me. So I'm living my authentic health career. I know you can too. It's just being clear about how to get there, and we'll talk about that in a minute. So one way to do that is to find these alignment. Sometimes we're just surviving. We're just dealing with too many Zoom meetings. We're dealing with COVID. We're dealing with economic challenges. Sometimes we're searching. It took me probably 5 to 7 years to make that big change that I made. And then sometimes when it all comes together, it's being. So the next slide, please. Wherever you are, you're exactly where you're supposed to be. And be bold. Mighty forces will come to your aid. This is a friend of mine, not Goethe, who's lived many centuries ago, but a friend of mine gave me this quote, who survived 2 nasty cancers and has sold and started 3 companies. And he's like, Jeff, if you go for what you're really supposed to be, forces will come to your aid. You'll be successful, because the next slide is, you are exactly where you're supposed to be. You have options. Move forward. Whether you know exactly what you want to do and you're like, Jeff, get on to telling us what we can do, or whether you're more confused than ever, or whether you're looking for a job and you haven't found it yet, wherever you are, it's okay. Start moving forward with intention from today. The next slide, please. So this is a pathway to your authentic health career from where you are. And these are the 9 steps that are written in my book that you can pursue, detailed in my book, that I've used helped thousands of students pursue their authentic health career in this way. So the first step here is getting more exposure to what's possible. So Tracy, if you can hit, there we go. Getting more exposure. That's job number 1. That's what we just did. What are the hot health careers? What are the major issues that are out there? What can you get paid for? That's the top of the triangle. The second step is to do the bottom of the triangle. What are your values, passions, and goals? What is your why for being in the health field and the kind of difference that you want to make? What are you good at and enjoy doing? So being really clear about those things and assessing them, getting feedback from others. Then it's getting experience. The practical experience is really important to know that what you think you might want to do in terms of health careers, the health issues you want to work on, the type of organizations you want to work in. We're going to talk about that in a few minutes. Practical experience, particularly before going back to graduate school, is really important. And then either after graduate school as well, it helps you affirm what you really want to do. Then you've got to choose and actively pursue a direction. You can't just have, I got 25 things I might want to do. You want to hone in on 1 to 3 things that would be the direction and develop an action plan to get there. After you've done the homework about what's exposure, what experience you have, and doing the self-assessment work. Next slide. I'm sorry, the next issue is then notice your education follows that. So those of you who are asking questions about, well, how do I pick the right graduate program? How do I combine my passions and education? Doing your homework, getting exposure, experience, choosing a direction, and then your education, particularly your graduate education, but also your undergraduate, should align with the direction that you want to go in. You want to make sure it has the knowledge, the specialized knowledge, skills, credentials, and contacts that you want. But notice education doesn't come first. I'll talk to a lot of students. I'll say, what do you want to do? I want to get an MPH. And that's a good answer. We want you to get that MPH, but we want you to know your why first and how you're going to use it, which is what the other steps do. The next slide. Then it's about packaging. How do you package yourself and promote yourself? It's great to have a good education. You all are going to get, some of you are getting a great graduate education now or undergrad education, but you got to let people know. You have to have a good LinkedIn profile. You have to have a good resume, good cover letters, those big, good interviewing skills. And that packaging is not enough. You also have to have a good network, and it's either network or not work. I'm going to repeat that. It's either network or not work, because especially right now, it's hard to get a job. You can apply to jobs with thousands of other people, and some of you will get them. But if you have a good support network, personally and professionally, and have the skills to network, you'll go much further. Then that's even not enough. You still have to also believe in yourself and have the courage to choose that authentic health career. For me to take a 70% cut in salary to pursue what I wanted to pursue. And I made that back plus. And I would do what I'm doing for free. But it took a lot of belief and courage to do that. And some of you to tell your parents that you really don't want to be a doctor, or that you do want to go into mental health or public health. Is going to be a big thing. And finally, it's going to be a period of adjustment. The world is changing now more than ever. And so we're going to have ongoing learning and adjustment that you're going to be addressing as you go forward. But this framework is a way for you to be able to do that, because no matter where you are in your career, you can continue to get more exposure. You can continue to get more experience. You can continue to network. You can continue to do these kinds of things. So this is a way you can use this as a diagnostic. What do I need to do? And that'll be the next slide, actually, is picking one of these framework elements that's a strength for you, whether it's belief and courage or exposure or experience, and then saying, okay, what am I going to do next? And this is something for you to do as a take home. And then select an element or elements that will help you advance towards your authentic health career. And then take action. This is really about action planning. It's not just a nice exercise. It's saying, what do I need to do to move from where I am towards my authentic health career? Taking action to be able to strengthen that particular element. Do you need more belief and experience? Do you need to strengthen your network? Those of you who are undergraduates particularly need to enhance your exposure and experience and those kinds of things. And some people think this is too linear of an approach, but it's a way to come up with a path going forward that's well informed based on your actual experience and assessment work. And there's a saying that opportunity is where luck and preparation meet. This is the preparation. It allows the luck and the kind of the going with the flow to work from there. Next slide, please. So we're now going to do a little bit of a polling question, actually, which is which of those elements, and we're going to list the elements there, which are the ones do you most want to strengthen in the next 6 months to be able to advance towards your authentic health career? Do you need more exposure, assessment, experience, etc.? Yeah, good to see that many of you understand the need for more exposure, and you do need to have that assessment to really understand your values and passions and goals, and then how to map that out onto the career path. So we'll talk about that in just a minute. And then it does take time. You do have to choose that direction and actively pursue it. And I'm glad to see that experience is the top one, because, and I know it's not easy to get right now, although there are going to be virtual internships, and I'll share one with you in a moment. But getting more experience is a great way, in addition to the other work here, to really, and building your network are going to be key. And you can do that in this era. It just takes a little bit more intention and focus, but I know that you can do it. So great to see that. And I encourage you to develop an action plan now, 3 steps you're going to take to advance in each one of these areas going forward. So how do you get more exposure, given that was a big one? You want to get exposure to the trends, the abundance of opportunities that are out there, the types of roles and job classifications and what employers are looking for. So the next slide is going to show some of the big increasing demand that are out there. This is the top of the triangle. What are some of the issues that people that are in most demand right now going forward? And the good news is there's a lot of them, and I bet a lot of you are passionate about these different issues. So pick which of these issues that you're interested in, find the organizations that are the leaders in doing that work, reach out for informational interviews, look for internships, look for jobs, look for people from your school who are in that organization or working in this field, and continue to get more exposure and experience, to pursue it. The next slide, please. What are employers looking for? I'm spending a lot of my time right now with employers and finding out what they're looking for. It's amazing how consistent the messages I'm getting are, that people are really interested in folks with these skills. It's across all different sectors of health, all different types of roles. And so it's really about your communication skills, as somebody mentioned earlier, analytical skills, project management. If those of you for undergrad, being good at Excel and some kind of data analysis would be helpful for you to be able to get a job. And then I'm hearing that people really want to know now that not only do you have the technical skill, but you have you're adaptable, you're flexible, and you're resilient. You're okay with uncertainty, which is hard in this area, but it is important. And that you do your homework on the values and the culture of the organization that you're applying for, and that you bring an enthusiasm and a fit for that. So these are areas that you can all strengthen for what employers are looking for. The next slide, please. These are ways to get practical experience, and my book details a lot more ways to get those experiences. And I'm going to move on a little bit faster so we have more time for your questions and answers, but these are ways to focus on practical experience. The next slide is talking about what job opportunities. Somebody asked this, what are some job opportunities for people coming out of undergraduate to work in the health and public health field? And the organizations on the left there are the types of organizations that I found are more likely to hire undergraduate students. The programs, there are also great programs like the CDC Associates programs or the Global Health Fellows or Health Career Connection that I run, focus on undergraduate students. And so I encourage you to look at these types of organizations and these programs as they're starting now, because many of the applications are out right now, to help you have a path for going forward. And these next one are the kind of titles that you might look at. These are the kind of job titles, and we'll make these slides available to you all and the recording as well. But you'll be able to see these are the kind of titles that I found people from undergrads, and many of them also for people coming out of graduate school. But for graduate school, many of the roles may be more like project manager or senior analyst or consultant or something like that. But these are all different types of titles, and it ranges from being a consultant to an analytical person to an advocate, or those of you interested in clinical work, being a scribe of some kind. So these are specific types of job titles. There's a lot of coordinator jobs I'm seeing now: population health coordinator, research coordinator, those kinds of things. So these are the job titles. Next slide. We're going to go past this one. Hopefully you all have heard the importance of experience. And I'm going to now have you do a little bit of an exercise, 5 quick questions, and then we'll get to your questions about how to choose the right direction, because having a direction is important. It's not set in stone, but it's a direction that you're going in, because you can then you can get in the flow of people and opportunities with a focus. I would not have gotten into my MBA and PhD at Berkeley without a focus on hospital administration and getting into that program. And it can snowball by the things that you do. And I encourage you to set goals and an action plan of how you're going to pursue your direction. So how do you come up with a direction? The next slide, and then one after that. Next slide. I'm going to ask you to answer these 5 questions as I go through this. And it's only going to take a couple minutes, and this will be more for homework. But I'm going to ask you to write down and think about for yourself. If you had to decide today on your direction, first question is, which population or populations would you be serving in public health? Is there a particular population, the older adult population, teenagers, children, underserved populations, the population where you're from? So write down which population that you might want to work on. Is there a particular health issue or determinant of health that you want to work on? Back to that issue you are passionate about. Or maybe it's housing, maybe it's access to care, maybe it's education, maybe it's food security. Is there a particular type of organization that you're more interested in? Hospital, a health plan, a public health department, a biotech department, organization, academic. What role or function do you want to play? Do you want to be an administrator like I was? Do you want to be a infectious disease expert, or a doctor, or a health educator? How close to the patient do you want to be? Are you someone who wants to work in health policy on a state or federal level and make policy that affects millions of people? Or you want to be grounded in the community, be somebody who's seeing individual patients, who's walking out the door and being in a community that you're helping empower? No right or wrong answer, just what's right for you. What impact do you want to have? In the end, you may work, unfortunately, you may work more, depending on your choices, more time at your job than with your family, unfortunately. So how are you going to know if you're successful personally and professionally? And what does success mean? It's good to work backwards from the end, right? Rather than finding out at the end that you don't have the success that you want. So I found that if you can answer these questions, you can really get a good idea. You can say, I want to work with the Native American population in rural North Carolina, where I'm from and my tribe is from. That's me. I want to work on diabetes and substance use, because those are the big issues facing our community, and violence as well. I want to work in a community health center as a medical director and as somebody who's seeing patients, or as a health educator. And I want to be grounded in the community, but I also want to work on health policy issues at a state and national level to have a bigger impact. And my own definition of success is I reduce the rate of diabetes and violence and substance use in my community. And I'm also able to have the lifestyle that I want and honor my values and my family and my spiritual goals, and have the time to travel and do other things that I want. So by defining these kind of questions, you're able to come up with your direction. So I encourage you to spend more time on that going forward. And in the interest of time, we're going to go down to the next slide, please. If you don't know yet, it's okay. Get more. If you don't know the answers to those questions, it's a sign that you need more exposure, experience, mentorship, networking, and those kind of things. So go forward, pay the bills, get your experience and exposure, and keep the faith. It only takes one. So what can you do now? Next slide. Put yourself in the flow of people and opportunities. Do informational interviews, get involved in a lot of networking. It may be virtual, but you can definitely benefit from it and do it. And then get back to where we started. Tap into that passion. Follow your passion, your purpose. Use your mentors, leverage them, and find mentors. And then kind of be open to what's possible. Right now, it may not be the path that you thought you were going to pursue. It may be something different, but get your foot in the door in a good organization, working on something that you're interested in, or in a good graduate school. And then, widen your lens. You may have to widen your geographic job search further, or different types of companies, but put yourself in the flow of people and opportunities. Next slide, please. I'm going to skip these job tips, search tips. You'll have them in the slides afterwards. ASPPH is a tremendous resource. There's so many things online that you can look at. And there's some other webinars that I will share with you. And if you give me your information, there's a link that I can send you more information. I'll send you many more webinars and other kinds of information. Next slide. I have this weekly forum from 5 to 6 p.m. Pacific on Wednesdays called Health Career Conversations, where I invite different health leaders. And we spend an hour informally talking about different types of career opportunities. The ones that have already happened, I have recordings on. I can send them to you if you can put your email in on that form. And then there's some other ones coming up that I invite you to, including an interesting one on Monday and actually should be the 23rd. I'm sorry, on biotech and pharmaceutical career options. But you can see it's basically a good chance to get more exposure and to connect with people to get some more experience. Lastly, I'm going to talk about Health Career Connection. The next slide here. HCC is a national nonprofit, provides paid summer internships in the health field in California, New York, New Jersey, Boston, Nashville, North Carolina, Washington, D.C., all throughout California. And it's a paid summer internship program, full-time, 10 weeks, exposure, experience, mentorship, professional development to pursue health or public health careers. We are trying to focus on increasing diversity in the health professions because of the need that we talked about earlier. So we do have a priority for people from backgrounds that are underrepresented, or people from under-resourced communities or low-income backgrounds, but everyone is welcome. The deadline, next slide, is December the 13th. The application is available at healthcareers.org, but you get paid, you get great experience, and you get connected to our graduate school partners, which is the next slide. You can see we have partners with public health, with medical school partners all throughout the country, some of the leading ones. They're all looking for HCC alums. And so I encourage you to apply by December 13th at midnight. And we'll do our best to see if we can provide you with an opportunity. Next slide. And I also have some recorded webinars that you can tap into on my website, jeffoxendine.com, about other kinds of health career options. And then finally, I've already talked about my book. Next slide. You can follow me on social media, or just reach out to me via email, oxendine@berkeley.edu, or link in with me. Happy to connect with you. And then finally is just go confidently in the direction of your dreams. And I know that you'll be successful. Choose that direction, choose your authentic health career path. You'll believe that it's possible and fully go for it. And I know you'll be successful. And these are some examples of people who have. This is one of my students who's working in global health. Many of you are interested in global health, getting her MPH. She chose to focus on health administration first, but then shifted to global health work. The next slide is one of my colleagues who is an MPH and MD, and she returned to serve her community in the Inland Empire, focused on child and adolescent psychiatry, which is one of the most needed areas. And she's combining that with being an advocate in public health. And lastly, some folks that have dual degrees in public health and public policy, they're pursuing their authentic health career. They're smiling, and I would love to see your picture standing next to me or someone else who is supporting you to achieve your authentic health career. So I hope today was helpful. I'm going to now answer a few more questions from the Q&A. And thank you so much for your time and your attention. And I encourage you to pursue your authentic health career as fully as possible. We need that for you to do for yourself and for all of us going forward. So in terms of some more questions, how do we get experience right after graduating? I think we did talk about that already, as far as being able to look at jobs in organizations or in programs that are focused on undergrads, health plans, consulting, health systems, public health departments. I think there's going to be more funding going into public health. And I encourage you to even think about things like being a contact tracer, working as a recovery specialist related to COVID, being part of distributing the vaccine that comes up and reaching out to people to educate them about the vaccine and about the pros and cons. Being involved in what's happening right now on the ground with COVID or in the economic recovery that's going to be needing to be taking place. How do you determine specialties in public health? I think it's getting back into that, in touch with what are your unique talents, passions, and goals, and getting exposure to those specialties, talking to people who work in them, talk to people who teach, who are going to graduate school in the different specialties that you might be interested in, going to pre-application advising sessions, and then getting work experience, doing some work. One of my students thought she wanted to go into health and social behavior. She loved health equity. She loved public health departments. And she went to work in one after her internship. And then she discovered that, you know what, I like health equity. I love health equity. I love health departments, but I want to work more on health management. I'm good at it, and I enjoy doing project management. I enjoy doing analytics. I enjoy leading teams, and I enjoy doing the budgets. I enjoy, the management part of it. So she shifted after her experience and exposure and to be able to go, oh, this is what I'm good at and I enjoy doing. I can still work on health equity, but health management is more of a practical path for me than health behavior. So I think it's getting those kinds of experiences that are important. How can we pursue a career leveraging data, digital health in public health? Can this be done in the private sector? Yes, I had a webinar last night on careers in the private sector that I can send out the recording to you about, or you can email me about, the person who's interested in that. But there's an explosion right now in digital health, in data and technology in public health. And I think it's only going to be increasing. Some of the advice was to maybe start out in a startup company of some kind. And you can look at who's being funded in digital health. There's billions of dollars. Last year, there was $10 billion invested in digital health. And a lot of that was with startup companies. So maybe getting a job in some kind of startup company that's aligned with your passion, because then you can get a certain skill and exposure, but then you get a lot of experience with how the whole company works and what kind of thing you might want to do. Or you can go in to do some research around the impact of digital health, or go work in a hospital or a health system in some area. And many of you are going to be digital natives that may bring that kind of technology and data expertise, and you can apply it in whatever aspect that you work in. I've been told that getting into tech is a little bit harder unless you have more of an engineering or a coding, software engineering kind of a background. So maybe looking at startups or health systems or just public health departments as well. Let's see. Tracy, I know, do we have a couple more minutes? What combination of physician work and public health looks like? I think I talked about that. I'm a current public health professional in the government sector. I'm finding it difficult to rise to the top in terms of a leadership position. Any advice? That's a tough one in the government sector. I've been told that it helps in the government public health sector. You oftentimes need to go from sort of maybe one organization, sometimes to another outside, in order to make an advancement opportunity, which might be tough if you got seniority and those things in your organization. Maybe being part of public health leadership programs. I think there's going to be more programs for emerging leaders in public health outside your organization that you could be part of. More school beyond an MPH may be good for you, but I wouldn't necessarily say that. I think strengthening your skills, I think volunteering and stepping up to take initiative, leadership of different projects, different new ventures that your organization's being part of, and then finding some mentors of senior leaders and letting them know what your interests are, and letting them, giving you advice on how to proceed going forward. Let's see. What's the advantage of getting an MBA, an MHA versus an MPH? What's the difference? I have a whole webinar on that. But basically, you need to look at the school, degree, and program you're going to. Some MPHs are like at Berkeley and at Harvard, they don't have an MHA, but they have really good curriculum in health policy and management. An MHA is sometimes more regional in nature. The Midwest, the Southeast has more MHAs, the Northwest. Sometimes the MHA has more a focus on more corporate kinds of opportunities and more large scale, like managing health plans or hospitals and some things, but not necessarily the case. So I would look at the curriculum side by side. I'd look at the jobs that people go into afterwards, and I would talk to people who have the different degrees to get their perspectives. So unfortunately, I know we're at time. I don't want to carry over. I know there's many more questions. So thank you for being here today. I hope this was helpful for you in beginning to think about and pursue your authentic health career. Please go for it fully. Please sign up for me in my form if I can have send you more information and provide access to more webinars and more resources and internships that are out there. Please apply to Health Career Connection if you're an undergrad student interested in public health, and read my book if you think it'll be helpful to you. You don't have to be a doctor. So with that, I want to thank ASPPH, Tracy and Aaron for this opportunity, and thank you all for joining, and please stay safe and healthy. And we'll see you in the public health field pursuing your authentic health career. Thank you very much.
Thank you, Jeff. Thank you, everybody, for joining us today. Have a great afternoon.